Dr. Peter Chin-Hong joins me from San Francisco. He's a professor of medicine and infectious disease specialist at University of California, San Francisco. Peter, good to see you. I want to begin by just getting your take on, is this the right time to ditch the masks?
It is the right time to have a mask mandate be lifted, but it doesn't mean that it's the right time for everyone to ditch the mask. Like Dr. Walensky says, we still have over 2,500 deaths a day in the US, which, if you compare it to flu, which we think of as endemic, it averages out in a bad flu season to about 100 deaths a day. So, I think that's really the stickling point. But, I think you're moving, what you see happening in the US is a move from the collective, everyone hit with a sledgehammer doing the same thing, to one of personal, responsibility that may depend on your own risk-benefit calculus.
The mask rollbacks appear to undercut, Peter, the messaging from federal authorities and the CDC. So once again, we're getting mixed messages here. Who are we supposed to listen to?
I know it's really so difficult, and it really depends on localities. I would say in California, it's probably going to be the last place that would probably see restrictions lifted, mainly because California had, for more than a year, not had students in their seats physically. So there's a big collective, feeling that we want to have that safe environment, that teachers feel safe, students feel safe, and families feel safe. But it doesn't mean that those mask mandates won't be lifted anytime soon. It just will probably trickle and follow what's happening in the community.
All right, so let me move on to schools and youngsters. What is the data on this, Peter, when it comes to Omicron, its effectiveness, the effectiveness of masks in protecting children against Omicron? What does the science say? What does the data say?
Well, the data says that schools still remain a safe place. It doesn't mean that masks are the way that they remain safe. Masks are just one of several strategies, including vaccinating the adults in the people's lives, etc. It shows that most of the cases are still from the community and not intra-school transmissions, even though there have been lots of people who've been diagnosed as students, but they generally have gotten it from the community. So I think that's kind of where we are when we have overall mask data in the community, but not recent Omicron mask data in schools saying that masks really have, added, a significant protection, but rather is one of several strategies.
So let me ask you this. If a parent came up to you and said, I have a, third grader or second grader in San Francisco Bay Area, and should I continue to have my child wear a mask indoors, what would you tell that person?
I would say for the time being, given the fact that we're not completely down the mountain, if you want to give some estimates of where we are, in California, we're probably where we were in December 28th or so, which is very different from, Thanksgiving or the time when we reopened California in June of last year. And to give you numbers, at the peak, we're about 300 per 100,000 cases in the community. Now we're down to about 50 per 100,000, but very, very far from 10 per 100,000. So if you think about protection as preventing chaos and mayhem in schools because people are moving back and forth and doing hybrid, it's probably a simple thing to keep going until we hit that sea level, which we're going to get to really soon, just not exactly there yet.
And very quickly, I want to ask you about the numbers we're getting from the World Health Organization. Deaths are up, but cases are down worldwide. How are we supposed to read this? Is this good news? Is it bad news? Is it a little bit of both?
It's good news overall because deaths lag the cases that we see in the community. And deaths have been primarily among the elderly, maybe a little bit of immune compromise, but elderly, unboosted, unvaccinated is really where we're seeing deaths. And it's no surprise that, you have a decline in cases in the community and then deaths still remain high because it takes a while because we're trying to keep these people alive as much as possible. And they usually stay in the hospital for a bit. So that's why the deaths usually go after the cases.
All right, we'll have to leave it there. Dr. Peter Chin Hong, as always, thank you.